Learn about the county's model healthcare plan, convenient family clinics, children's programs, neighborhood and senior centers, transportation services, and more.
Welcome to Hillsborough Health, a series devoted to making sure you know about the services available to you in Hillsborough County. We're going to talk today about Head Start, and with me are Dr. Jackie Jenkins, who is the director of the Head Start program. Welcome. Mary Ann Kershaw, Quality Assurance Manager, and LaVon Nelson, the General Manager. So welcome to all of you. I'm glad you could be here. Let's start off for the people who I realized today don't all know what Head Start is, and explain Head Start and how long you've been around in the mission and so forth.
Wonderful, Louise. Actually, Head Start has actually began in 1965, so we're coming up on our 50th anniversary. It was a program that began towards the war on poverty, and towards that, Head Start offers several comprehensive services that support children and families. Education being one, social services is one towards the support of the family and the family unit, nutrition, dental, health, and what Head Start comprehensively offers is the ability for the family to maintain in life. It gives them a head start on child care options, life skills, and to maintain those skills for the duration of the child's life.
In addition to what Dr. Jenkins was talking about earlier, we provide comprehensive services, as she stated. We also have a huge parent engagement piece that we focus in on engaging families throughout the program, through our program options. In addition to that, we have a HIM program specifically for the men and a Lilies specifically for the ladies that we encourage parents to be engaged in that as well.
And I also just wanted to add to make sure that we include early Head Start as well as Head Start.
Excellent. Yeah, now her early Head Start is not as old as the regular Head Start, right?
That's
was added
correct.
on later.
That's
and
correct.
That encompasses children, what age?
Early Head Start, we accept children as young as 6 weeks old, and early Head Start runs up to age 3, at which time they're eligible to transfer and transition into Head Start, which is for 3 to 5-year-olds.
So what happens with children as young as 6 weeks old? Is it just caretaking or more than that?
Yeah, and that's a beautiful thing, and probably one of the best kept secrets about Head Start and early Head Start is that it's so much more than just daycare.
Right.
As young as 6 weeks old, our students have individualized lesson plans to help them with their healthy development. So their movement activities, different activities around attachment, some of the early developmental skills. As they get older, we'll be working on the fine motor skills, gross motor skills, all the way up to early letter recognition, sound recognition, shape recognition.
Where are the programs available? All over the county or in one spot?
With the Hillsborough County program, we actually have 19 center-based locations, but we also partner with the district schools also. We also offer family child care homes also through the YMCA program. Those are our delegates, and the Lutheran services also. What we've come to understand is, in representation of what's in the best interest of the child and the family, sometimes center-based option is best, sometimes a school-based option is best, and then sometimes home-based inside of a group size of 4 to maybe 8 is in the best interest of the family and the child. For early Head Start, early education, Louise, we understand that through research, the earlier that we reach the child and the family, the better it is going to be towards the duration of those skills in reference to the child's success. And so it's a learning process. We keep getting better at it. Each year we learn something brand new. And so we just kind of put our heads together to determine what's the next steps.
So I know you audit this program regularly.
Yes.
And you've had the 50 years now. Mm-hmm. Can you tell some stories about the difference it's made in a bunch of people's lives or in one person's life that you know of?
You want to start?
Sure. In addition
Yvonne?
to the Early Head Start program, we have Expected Parents program as well. It's called EPP, where we provide home-based services to those expected mothers. An expected mom, a teenage mom, who was thrown out of her home. She had no guidance. She went to a family friend that had a child enrolled in the Head Start program, and she brought her to our office. At that particular time, we had a vacancy. We talked to the child. We got the teen mom back enrolled in school, and we enrolled her into our program, and we tracked her in making sure that she's able to go to school, give her the resources she needed, and then her aunt ended up taking her into her home. After that, that child was able to transition into our Early Head Start program, and the child will be graduating this year out of the Head Start program. Once the child is born, we transition them, or they transfer into either the center-based option that we have or the family child care home.
What does it take to become one of these family homes? Is there a licensing procedure?
Yeah, the family child care homes are actually licensed through Hillsborough County, through child care licensing. So they have to meet, there are strict guidelines about what they have to meet. So it's similar to a center-based child care, but there are some elements that are specific to a family child care home. So they do have to meet the inspection requirements at the front end to be licensed. We have additional training that we require the family child care homes to be early Head Start ready. And then they have annual inspections through child care licensing and regular visits from us. So as Dr. Jenkins had mentioned, we keep a limit of 4 kids. That is a lower ratio than what child care licensing would require. But since we're talking about kids between 6 weeks and 3 years old, you don't want a whole house full of them.
Right.
So we keep it 1 to 4.
And in Head Start itself, what are those numbers?
In the Head Start classrooms, there are up to 20 children in each classroom.
But they're already 3 or 4 years old, right?
Yes.
And you have volunteers in those programs as well?
Oh,
Do people
Yes.
volunteer to
Yes.
help with these
Oh,
programs?
most
Yes.
definitely.
So people who are watching this who would like to volunteer can do that?
Oh, yes. LaVon, would you talk a little?
If anyone's interested in volunteering for the Head Start program, they can come to the administrative office located on Waters, 3639 West Waters Avenue, Suite 500, and we would provide to them as an orientation. Depending on how many hours they would like to volunteer, they may have to do a background screening
Right.
prior to going and working in the classrooms with the children,
Right.
or they can come to the office and volunteer at the office as well.
I remember that I was told long ago that one of the reasons to have a Head Start program was you had children who were able to go to preschools, so they had more social skills than perhaps a child with low income would have. And one of the ways to catch them up was to do this. Is that correct? Or-
That's correct. Louise, what we're finding in the field of early childhood education is socialization is so key. Previously, it was thought to be that this was babysitting and that, children as young as 6 weeks could not learn. But we understand that even in utero, that the mother and the child are developing, and it's a key part and piece to reach the development of that fetus and that mother, so that at the onset of birth, the family understands and they continue with it. We understand that in reference to social skills, a child's literacy, being able to speak, being able to, name colors, being able to talk about their environment, just to speak, regardless of their cultural diversity, it's what's going to support them and help them in life. And so within the Head Start programs, there's reading, there is reading, there is reading. And I also want to mention that in reference to the Head Start staff, our teachers are degreed. We have some teachers who are actually working on their doctorate degrees inside of our fields, because they understand the importance of reaching a child and reaching that family in reference to sustaining the future.
About how many children are in the program at any given time in Hillsborough County?
It fluctuates. Our funded enrollment for the Head Start program is, for overall with the grantee and the delegates, is 3,474.
Yeah.
So normally throughout the whole entire year, we have approximately 45 to 5,000 children that actually come through the program at the end of the year. through transitions or transferring or families moving out of the city.
And Louise, believe it or not, we're still not reaching every child
That's what
in
was my
Hillsborough
next question.
County in reference to an early childhood experience. So we still have some work that we have to do.
Can you actually accommodate more if they came?
We would appeal to
mean,
the federal
seriously.
government maybe for more grants or partnerships, because one of the key pieces for Head Start is partnering with local community agencies. The recognition that one particular agency is unable to do it all on their own. However, the more partnerships that are secured, the better we're able to reach all regions of the county.
How does the word get out now? I mean, a lot of people probably don't know they're eligible. How do you get that word out?
Our best avenue, believe it or not, are our parents that are enrolled into the program. They share the news, they share their success stories that they've gone through within the program. But in addition to that, we do advertise, we do door-to-door recruitment, we go out in the community and do presentations, we attend public and private events. So the word is out there, and of course through staff as well.
Staff.
We are our biggest advocates as well.
And as Dr. Jenkins was mentioning, the community partnerships, so like the Tampa Housing Authority,
Right.
they will share information with families because we already know they're going to have some of the income requirements already covered. We also work closely with Eckerd Community Alternatives, which is a local child welfare agency, because children in foster care are categorically eligible to be enrolled. So we work closely with those partners. We're always trying to expand the relationships. We have the Early Learning Coalition of Hillsborough County, the Early Childhood Council, so other collaboratives who are already working with agencies. I can't forget the Children's Board of Hillsborough County.
United
of course,
Way,
one of the big ones, United Way.
Foster grandparents.
Okay,
always
so
get
you just
nervous.
mentioned a couple of different eligibility items. What are all of them? One would be below the income, the poverty
guidelines.
federal poverty guideline level. That number changes from year to year, correct?
Correct.
Okay. What is it now about?
Because it's only slightly that it changes.
Right. It's for a household of one, $11,000 is probably the max. We have a
So
partnership.
if they made less than the 11,000, their child would be eligible.
Correct. That's
Okay.
We also have a partnership with the Homeless Coalition.
That's correct.
Which is through Metropolitan Ministries, where we automatically provide services at their facility for their families that are homeless.
Yes.
We have approximately 64 early Head Start and Head Start families enrolled at Metropolitan Ministries at their facility.
I want to hear about the other eligibility, but we're going to take a quick break. We'll be right back. Stay tuned. Thank you. We're back on Hillsborough Health, talking today about Head Start. I'm Louise Thompson, and with me are Dr. Jackie Jenkins, Mary Ann Kershaw, and Levon Nelson from the Head Start program in Hillsborough County. Before we took our break, we were talking about what the criteria might be for becoming a part of Head Start or early Head Start. And we talked about income level at 100% of poverty level, and if it's a foster child, doesn't matter, nothing about income applies.
No.
Are there other ways to be able to access the program?
Sure. One of the criteria for Hillsborough County Head Start under the Board of County Commissioners is that they must be working, going to school, or in a job training program, as opposed to
The mom, the dad?
the mom,
somebody?
the dad, or both parents, or the guardian must be working, going to school, or in a job training program. We also, with school district, those are non-working families. They do not have to be working at the time of enrollment. However, everyone must meet the poverty guidelines that are established by the federal government. In addition to that, we do enroll children with special needs. We have 10% of the children enrolled in our program are with children that are diagnosed with a disability. We have staff on board that assist with that and facilitate through that process to ensure that the children get the services that they need. If we have children with other conditions, we have mental health staff on board as well that are employed through Hillsborough County Head Start that can provide them those services too.
So as you can see, Louise, Head Start is truly comprehensive, meeting the needs of the child and the family wherever they are, be it nutritional, be it educational.
Yeah. What do you do on nutritional? You're talking about a meal that's served while they're at the Head Start program?
Yes. 3/4 of their daily meal is served through Head Start. We have registered dietitians.
Right.
3/4 of their meal?
Yes. That is a light breakfast, a
mhm.
lunch, and a snack. We provide that to the families when they come into the program. For early Head Start, we feed them on demand because we cannot put babies and toddlers on a schedule. But the 3 and 4-year-olds, we do provide the meals for them as well.
And
It's
the
just
meals
for
are
the children,
USDA.
for the family too? Or you get them hooked up
It's for
with?
the children. If there are families that need food or any kind of shelter or anything, clothing, we refer them out to other agencies. The good part about working for Hillsborough County government is that we have resources internally that we can utilize for those families to give those resources that they may need. So that's the great part of, one of the great parts of working for Hillsborough County Board
So
of County
your
Commissioners.
department acts as a referral agency to these other...
Entities within the county, yes, and to outside entities as well.
And referral in the sense where we sit down and we speak with parents upon interest to help them to determine what are your goals, what are some of the things that you would like to do in life. And through those types of conversations, those family engagement moments, we could determine that a family wanted to complete their high school diploma or possibly go back to college. Maybe home ownership was their goal. And so we're able to help them put that goal in writing, and through the resources through the county, point them in the right direction so that those goals are achievable. Because once that motivation kicks in, it's a high. It just keeps them going, and that is, I think, systemic of some of the children who are in low-income situations. Sometimes people are sad, sometimes they're depressed, and so when you help them become all that they can be, it raises their expectation about life and their future.
And I would assume once you have a child, you start thinking about those other things,
Most definitely.
as we all do.
And we're able to achieve those, finding what their goals are, where they see themselves within 5 years. At the beginning, we start that partnership. As soon as those families walk in that door, from the receptionist to the clerical team to anyone that comes in contact, that partnership starts immediately.
Does a family have a certain person assigned to them, or pardon the expression, caseworker? I'm not sure if that's appropriate for
That's
your
exactly
program.
They're
that's
called
exactly
senior
what it's
case
like.
managers. Each family, each center has a senior case manager assigned to them. That senior case manager works directly with that family, with that child, or with the entire family, depending on their need. All our senior case managers are degreed or higher, and they have extensive training. They've gone through the family development credential coursework, so we have qualified staff to ensure that we are providing the services the family needs.
The teachers are, they're not teachers from the regular school system unless somebody is partnering with you in the regular school system. Is
They
that
can
correct?
be, because some of our teachers have bachelor's degrees, some of them have master's degrees, and these degrees are from accredited universities. As I mentioned earlier, some are even working on their doctoral programs. It's towards the higher investment into early childhood education, and towards that, the Head Start program will actually support teachers in their credentialing efforts. If we see that it is a point where that teacher can advance to the next level through better education, the program is equipped to help them reach that goal also.
Is the program fully federally funded, or are the state helping with it, the local government, or?
It's blended. It's blended funding. The greatest part of our grant, 100%, is from the federal government. But because the federal government understands the needs of cities and counties and municipalities, there's an emphasis to partner with other agencies. And for that reason, we partner with the state through the VPK program. The USDA program offers us the nutritional dollars that we need also. And depending upon Hillsborough County, as LaVon mentioned, is a great place to work. you know, the county is also set up to help us in resources in meeting the needs of the program. The county is very vested in the success of our program, and I think that is the greatest draw of all for us.
I wondered about immunizations. Is that part covered?
Oh,
yes.
definitely.
Marianne?
Well, it is a requirement for any child who comes in through Early Head Start or Head Start. And we have health staff, social services staff, who follow up to make sure that those things happen. Because sometimes it may require connecting the family to a doctor, and maybe just reminding them that they need to get the immunizations and following up on it. But it's not something we do ourselves, but we definitely work together with the families to make sure it happens.
So that before they come into the program,
Yes.
they pretty much need to have these immunizations?
Yeah, whatever is age appropriate at the time they come in. But then, of course, keeping them up to date the whole time they're inside of the program.
Louise, one of the things that occurs is because the Head Start program is towards the success of the child, we pretty much are on the same schedule with the school system in reference to, you know, immunizations and birth dates, so that's a seamless transition for that family and that child.
Is this available through the summer?
Yes.
Yes.
We're a full year, full-time program.
The whole year?
Yes.
Yes.
So you can't really compare yourself that much to the school system.
Correct.
It's a different option. It's a different option in reference to our partnering with the district. You know, the district will offer a half-day program for a Head Start, but then on the other side, the district's responsibility is preparing the children through the elementary and the secondary years. And so towards the early childhood years, the closer the collaboration with Head Start or other agencies, early childhood agencies, the better focus that child will be towards life.
Is there any connection between your program and the pre-K programs that have started?
The pre-kindergarten program, which is volunteer pre-K,
Right.
we're a part of that. Dr. J kind of alluded to that earlier. We have children that are enrolled in the volunteer pre-K program within Hillsborough County Head Start as well as in the school district.
Right.
So we do partner with VPK.
I just wondered this because you have parents that you said might be in school
Right.
or working. And I know the major dilemma for a parent of a toddler is they got sick. They don't feel well, whatever. How is that handled in the Head Start program? Is it handled or do they have to stay home?
I'll speak to, you talked about just sharing success stories and happiness for me. You know, I remember starting as a parent, you know, early in life also. And towards the support of my even making it to the level where I am now, it's family support inside of there. It is, and through programs like Head Start and early childhood programs, the partner connections through the family and through the community helped me to understand that even if my child was sick, I could not attend a center-based option. There are other people who could come and help me, stay with her, substitutes who could come in and help me so that I didn't miss out and she didn't also. And so I can't emphasize enough the partnership piece inside of a child's life so that when those normal life things occur, there are parts and pieces that are in place that helps the family, especially single family homes, to continue and be successful.
So even if they had to stay at home,
Right.
the child had to stay at home, you
Right.
could get to work or go to school.
We have options either through the case managers, where if it's an extended illness for the child, where we've had case workers who will actually visit the home to ensure that you know, whatever lesson plan the child's class is receiving, that the parent, you know, stayed focused on it so the child would not fall behind. If it seemed that it was a larger disability or an illness, then we would partner with different people inside of the community to help the family to come in. You know, each case is specific and meeting that family's needs. Because we're so well connected with our partners, we will reach out to see what we could do to just envelop the whole.
Do you operate, you don't operate like the school system does, but in terms of a year, do children, can they come in anytime during the year, or does it have to be August or when school starts?
For,
They moved here in December.
For early Head Start, we transition them in until they're 2 years old. For Head Start, They have to be 3 by September the 1st, so we are based on the same school system schedule for enrollment.
So if someone came in with a 3-year-old after September, could they still get enrolled, or
They will not be eligible to enroll until June 1st of the following year.
But what we would do, we would partner possibly with a local family child care home or just another local entity if the parents' needs were met. And that's why I offered that there's a center-based option, there are school-based options, and sometimes there are family child care home options.
I don't think people really realize the extent of your fingers are in a lot of pies here.
Right.
I mean, that there's this much help out there.
Yeah, well, we normally
I mean, even if I think of Head Start and
Yeah.
I know about Head Start, I don't know this much.
Right.
So I didn't know you had so many other options available. I
And
don't know how you
supporting the
get that
family.
across.
And also in Hillsborough County, it's very complex because of
Right.
all of our partners. So people don't realize that we're all one Head Start system.
That's correct.
So there's only one Head Start grant here in Hillsborough County, and the county receives that grant. But then part of it goes to the school district, part of it goes to the Tampa Metro YMCA, and part of it goes to Lutheran Services Florida.
And the contractor sites.
And we have 4 child care partner contracted sites as well.
Easter
So
Seals.
Easter Seals, our club, Bible-based, and King's Kids. So people might see Head Start and not realize it's connected to the other place they see Head Start. So here in Hillsborough County, we're
We're
all
all
one.
one. We're all one.
How many staff are there?
Oh,
We
wow.
have, within the Board of County Commissioners, we have 278 staff.
That includes your administrative people
That-
and your teaching staff?
Yes.
and-
Drivers. Yeah,
Yes.
Oh, you have drivers, because transportation is also provided?
that's correct.
For
For the
field
children?
trips.
For field trips, yes.
Oh, for field
Not, yeah,
trips.
not daily transportation.
Okay, so they have to get the child there, okay.
And that's just
So-
the option that appeals to, because Tampa is such a metropolitan city, that the transportation in reference to picking families up door by door, some Head Start programs offer that, but this particular option was not necessary here because we're such a large metropolitan.
So we only have a couple of minutes left, so what I'm going to do is ask each one of you to either say something to the viewer that you think got missed or that they need to hear again. And I'm just going to give you a minute apiece, so I'll start with you, Lavon.
Hi, I just would like to say that Hillsborough County Head Start, Early Head Start program works.
That sums the whole thing up, huh?
Yes.
Mary Ann?
That really does. And also just want to encourage people, if you're interested in Head Start or have any friends, family members, go ahead and call our office, come by the office and talk it through. I know a lot of people think they know what they need to do, but we'll always have someone available who can help.
Your main office is not in the county center, right?
No, we're 3639 West Waters.
Which
So
makes
Waters and Dale Mabry.
Okay.
A program does not work unless the staff are vested and motivated to be a part of it. And so for that reason, if we have people who even think for a little bit that they want to help to carve the future of a child's life or a family's life, come and apply with us, because we're always looking for new people to embrace the future. It's a new future. It's one of techno this and that, and so we need different innovations, different creative minds to come and support us in our advancement towards education. And so that would be the message.
Oh, that's great. I think you're doing a fantastic job. We so appreciate what
Thank
you're
you.
doing to help the children of tomorrow, who are going to be, what, our leaders?
That's correct.
Most
Appreciate
definitely.
it very much.
Yes.
Appreciate your coming down, and I hope that people will tune in. We'll put your website up at the end of the program. Thank you for tuning in. We'll see you next time.